All right, we're going to get started for the sake of time. In classic YSPH fashion, there's a 1 p.m. class that starts in this room, so we're going to have to be out on time. Thank you all for joining today for what is an unbelievably special Dean's Lecture. I cannot tell you how fortunate I feel to be welcoming Dr. Elizabeth or Betsy Bradley to speak today. As many of you know, she is our 2023 Wilbur Cross Medal recipient. For those who aren't familiar, the Wilbur Cross Medal was named in honor of former graduate school dean and governor of Connecticut, Wilbur Lucius Cross, and since 1966 has been an honor presented each year by the Graduate School Alumni Association to a very small number of outstanding Yale alumni. Now, Betsy has asked me to not share her quite storied trajectory, both within and outside of Yale, because I would be stealing her thunder from the talk that she's about to give. But I would be remiss to introduce her without talking about the fact that she has been influential on generations of Yale students and alums. And I will let you tell your story, but you will hear of many, many things that I know many of you in the room know about, but that I, even as a relatively new member of Yale, thought of as part of what made YSPH great. And I will also say personally, Betsy has been a mentor and advisor to me. So although I have just become part of this community officially, I feel as if I've been part of it for much longer thanks to her. And it's really tremendously special to get to hear her today, sharing her wisdom, her experience, her trajectory with us. So please join me in welcoming Dr. Bradley and giving her a big thank you for her visionary leadership, her staunch support of liberal arts education, and her advocacy for inclusive leadership. Betsy, it's a privilege to have you here.
Thank you so much. It is wonderful to be here. Truly, I'm looking at different people and recognizing you from so many different parts of my life and career. It means a tremendous amount, both to be recognized in this way, but more to be able to spend time with each of you today. We have an hour. Let's make the best of it. I have a few remarks to give, a Dean's Lecture, and be happy to have questions or discussion afterwards. So I thought that I would actually talk about this topic, getting on the balcony. And I am going to explain what that's all about, but not for a few minutes. Much of what I'm going to talk about is really due to what Yale has given me, particularly the Graduate School of Arts and Sciences, and so many mentors who are here, colleagues, friends. You really have inspired me. You've lifted me up when I lacked confidence, which has been many times at various points in my life. Who hasn't? You've promoted me. You've comforted me. You've added tremendous laughter to my life and a ton of joy. So I find myself full of gratitude for being in this room. And it's a funny room to me because I actually took my very first doctoral classes in this room with some faculty who are still here. So I'm having this overwhelming sense of joy and PTSD all at the same time. I do want to shout out my husband for 38 years. And he is a Yale College graduate and the best partner anyone could ever have. When you're with John, you feel like you can pretty much do anything because of his faith in the goodness of humanity. And I hope it's rubbed off. He's not here right now because it makes him too nervous to see me talk. And his mother is not doing that well in Guilford, so he's visiting her. Now, because we have students in the room, how many students? Could you just raise your hands? Of course, we're all students, so, okay, the students paying tuition, the rest of us are just learning. But because we have students in the room, I thought it might be helpful and interesting to talk about my experience in terms of transitions, because most students are in a transition one way or another. I actually love transitions, though they are very unsettling also. But the reason I love them is because they allow a time of disengagement and then re-engagement. And in that moment, when you have just disengaged from previous work, but you're not re-engaged fully in the new work, all things are free. All things are unencumbered, full of potential, open to what might be new. And you think about shifting gears in a car. When the clutch is in before you accelerate, think about shifting weight, for instance, when you're skiing or skating before you're going to do a great turn, or shifting weight in a dance before you're going to reconfigure the body. It's a time of promise. Transitions for me are really at the heart of learning. So I've had the benefit of several transitions in my career, and an academic career allows for that. I guess because one of the core missions of the academy is really the pursuit of truth, with the emphasis on the pursuit, not the attainment of truth. So transitions are really special and fundamental role in this pursuit, a role best understood in retrospect, because when one is in the dance, it's difficult to perceive the pattern of the dance. Preparing for this talk gave me the opportunity to get on the balcony, which is a phrase coined by Professor Ronald Heffitz at Harvard, and it means step back. Step back and see the recurrent patterns that emerge during the daily flail of work. Are any of you ever in a daily flail of work? Well, I hope our balcony tour together today, while we have the time, may be helpful to you, because I anticipate some of you are approaching a transition, you might be in the middle of a transition, or you may be recovering from a transition. My first graduate school experience was at the University of Chicago, where I received an MBA in health administration, and I chose that career after taking a course with Professor of Sociology Paul Starr, who at the time, it was 1983, was writing the book, The Transformation of American Medicine. Some of you know that book? They still assign it? Okay, good. Healthcare was changing from cost-plus reimbursement to capitation. DRGs and HMOs were cutting edge. No one really knew what they were. And careers in this field promised to be meaningful. And after school, I pursued hospital administration at MGH, Mass General, and really enjoyed the pace of the challenge, the impact you could have on patients and their families. I got to work with Professor Don Berwick, who was an assistant professor of medicine in those days, just barely cutting his teeth, taught me about quality improvement. It was so exciting, probably because of the inclusive leadership, which is a phrase we now know, but didn't know then, but that's what it was. And it was such a great equalizer in the hierarchical power, hierarchical system that is in medical care. So I loved quality improvement from the beginning. And life was so good at MGH. I enjoyed my work tremendously, but there were two forces that led me to a transition. First, I turned 30, and I know 30 is the new 18, someone told me that now, but for me, in 1991 or something like that, I really wanted to have children. And I knew no woman in the senior administration at MGH who had children, not one. And then, I'm sorry to say, the CFO sat me down and said, don't worry about it, you can have kids here because we have a mommy track. I did not like that idea. And then on a more career-defining level, I knew that I was working my tail off to improve the experience of patients. I knew the admission process was better, and I knew the emergency department and getting a bed was fast. But I'd go home every day through the emergency department off onto the red line, and I would see many people who were still homeless, tons of chronic illness, lots of obesity, drug use. And I just had these burning questions of why am I killing myself in this hospital? And it is getting so much better, and yet Boston not getting any healthier. So I went through a sizable transition with all the attendant emotional uncertainty and worries, and ultimately decided to pursue a PhD to attain more tools, theory, and methods to pursue the truth of how we could improve the healthcare system, already then recognized as hugely expensive, replete with medical errors, and losing the public's trust. Thank you, Yale, for accepting me. My bosses at MGH were totally baffled. They said I was throwing my career away. And I will say my father thought it was the biggest mistake I ever made in my life. And he said, why would you want to get a PhD? That is such a waste of time. And you have a career. So he was not an academic. I adored my doctoral training, which began right here in this room. I had wonderful faculty here in the School of Public Health. My first class was with Professor David Williams, who I know is now in Harvard, and he taught me about the social determinants of health. When he showed that chart where only 10% of the averted deaths are due to medical care, I raised my hand in that class and said, "What? I've spent so much time at Mass General Hospital, and I am sure it's more than David Williams," I said this to. Whoa, it took a while. But I have to say, after a semester, a few more years, public health really sank in, and I understood the differences in a very profound way. My learning curve was super steep, and was what's known as a philomath. So that's not a polymath. A polymath knows lots of different things. A philomath likes to study everything. Doesn't mean you necessarily know it, but you like to study it. And I took classes in history, political science, economics, sociology, tons and tons of biostatistics. Thank you, Elizabeth Klaus. Epidemiology. Thank you, Rob Dubrow. And health policy. Thank you, Mark Schlesinger. When I finished, my faculty then actually helped me transition into an instructor role and finally an assistant professor here in the school. And I'm grateful to the dean. Dean Mike Merson really opened the door for me to get my first research grant. Sam Chauncey, who I see is right here, opened the door for me to teach health management, which I had some experience in, which was good. And to Mark Schlesinger, Sally Horowitz, and Jody Sindelar, who really supported my application to be an assistant professor here in health management. And off I went, gears fully switched from hospital administrator to academic. I was inspired. I thought, I get to teach, I get to study, and people will pay me to do this job. And I get to set my own schedule. So like so many academics with young children, which I had 1 and then 2 and then 3 before I knew it, I worked part-time for a few years. And then I worked full-time. But I'm just wondering whether there are any young parents in the room who have the same hours I did. Start at 5 a.m., end at 7 a.m., because you got to feed everyone, drop them off. Start at 9 a.m., go to 2 p.m., then you got to pick them all up. And then you got to feed them again, and then start again at 9 p.m. to midnight. Does anyone have that? There must be some of you. And I felt my family gave me grounding and perspective, and of course, enormous love and support, which helps any career along. During review and promotion time, life became very stressful. I'm sure you relate to this, particularly as Yale would ask us to frame our work, to boil it down to a few punchy sentences. And I was hounded by the question, but what is your focus? What population, what disease are you expert in? Remember philomath? This was tough for me. By my 10-year review in 2006, I had 115 peer-reviewed papers, 15 book chapters, and strong external funding. But I was all over the board. I had 30 papers in end-of-life care, 20 in long-term care, 20 in quality improvement, multiple in involuntary job loss. Why? I don't know. Utilization review, insurance, competency-based education and management. I mean, really, I was shameless. You got a question? Let's try to answer it. And then a transition brought about by one of my former students, Kristen Maddox, who was working with Dr. Harlan Krumholtz here at Yale, a creative, generous, and outstanding mentor to me. The student, who is a teaching assistant in my methods class, which was right in this classroom, introduced me to Harlan saying, oh, she knows how to do qualitative research. And Harlan was, well, like, what is this? Is this really valuable in any way? But we started to collaborate on solving a problem. And the problem was, in 2003, only about a third of patients with lethal heart attacks were getting care, opening the coronary artery, within 90 minutes of arriving at a hospital. And opening that artery was everything for saving lives. We noted, however, there were a set of hospitals that were consistently getting it right. Their data, and there were like only 11 in the country, and there are thousands of hospitals, they were so fast and so successful. And amazingly to us, on our privileged perch, these were no-name hospitals. They weren't like the Mayo Clinic and Yale New Haven Hospital, places you never heard of. So we asked, what do they know that we don't know? And we sought to study them intensively, extracting the recurrent themes of their behaviors, practices, equipment, culture, leadership, space. What were they doing? We hypothesized how they did it once we had really studied them, and then tested those hypotheses through a series of quantitative studies. We found a handful of tricks. Some were really technical, like how do I get an EKG from the paramedic in the cab, in the ambulance, to the hospital before the patient does so they can get prepared. And some were totally political. How do we get emergency medicine to be able to activate a cath lab instead of a cardiologist? But together, these tricks made all the difference. And then Harlan led what I would call a grand strategy to adopt those evidence-based techniques, working with the physician relicensure program, working with reimbursement rules. Amazing. And just 6 years later, 95% of patients were getting that kind of life-saving treatment within 90 minutes. And that was such an inspiring thing to be part of. And in fact, that was a transition in that industry from one way of practicing to fully another. And it took questioning the accepted practices, taking time out to study and think, and then fearlessly making the changes to plot a new path. I have to say there are so many times I've been so proud of this work because truly it's come home to me. I've had friends, I've had employees who have had STEMI heart attacks, and they've lived. And I often think, like, wow, that's just the power of research. We used a method known as positive deviance, which means looking at outlier institutions that achieve amazing results and try to, from the same environment that others are not, try to study them intensively, pitch hypotheses, test the hypotheses, and then spread the evidence. Our work in those days was getting a lot of press. It was very exciting to be in the New England Journal, JAMA, and the Archives of Internal Medicine all in the same year. And of course, tenure felt really good too. Plus, in 2005, I had a sabbatical. Sabbaticals are great times for transitions. And although I was very happy in my role, a transition was on the horizon. This time to leave my focus on hospitals in the US and begin a decade of work in global health, largely in low-income settings. Again, many people thought I was really making a big mistake to do this. I was very happy on my sabbatical in 2005, minding my own business upstairs on the 3rd floor, door shut, when the Clinton Foundation reached out to me by email, I still remember it, to discuss Ethiopia. The only thing I knew about Ethiopia is it had a lot of famines. I knew nothing about that country. And in fact, it turned out it was all due to a former student, KP Yelpala, who I think some of you will know as a fellow of the School of Public Health now. He happened to be having an internship with Ira Magaziner, who was running the Clinton Foundation. And President Clinton and Ira met in Ethiopia to ask, what can we do for you? You know, this was very big in the Clinton Foundation, go back to Africa after not doing so well with Rwanda during the genocide and try to give back. And the Minister of Health there, now the General Director of the WHO, said, all I really want to do is improve hospitals. So KP turned to Ira and said, you know, not very many people do research on hospital management, but I know somebody. You should go talk to Betsy Bradley. But he never told me this is what had happened. So I had no association with Ethiopia. When they contacted me, I immediately convened everybody I could in the School of Public Health who worked on AIDS, because I'm thinking Africa AIDS, that must be what they want to talk about, or Africa. And I assumed I would facilitate the meeting like a catalyst. I'd be there in the beginning, I'd help the conversation get going, and then I would leave it and go back to my sabbatical. It's not what happened. They showed up in the Weinerman room, where I just was, and they went around the room to describe what they really needed. And they talked about hospital management. And I don't know, there was something in me. I just realized, oh my goodness, I think I could help you. So we created a team, I wrote a grant, and off we went to Ethiopia, leaving 3 young children behind for a while. My husband came with me, and we said we would never do this, but we did it. And we started to work on what now is known as health system strengthening. And this work was profoundly fulfilling. It led to a decade of expanding global health at Yale. It included, with the creation with Mike Skonechny, who I'm so happy to see here, the creation of the Global Health Leadership Institute, which I think is still alive and well, with Professor Leslie Curry and Erica Lenander. And research was really the bedrock of the work. As we're teaching from an evidence base, but we really wanted to use the research in the country that would generate new evidence in that country that we thought actually could be implemented. And we spread that in several low-income settings in Africa and Asia. We evaluated countless interventions, largely in the area of leadership development, management systems, data monitoring, with the goal of equipping and empowering communities with tools and practices to meet their healthcare needs, whatever they may be. Consistent with the conceptual underpinning of global health versus international health, the US is really part of the globe. And although I was largely funded to do global health work that decade later, I did continue to tussle with those early issues Professor David Williams first taught me in YSPH about the social determinants of health. And with, again, another sabbatical, 2012, I was asked to write a book with another former student, now Professor Lauren Taylor, on the findings of what happens with the investments in social services, housing, education, nutrition. And we had done a small paper on the findings that really, if you invest in those areas, it's very predictive of population health outcomes, which, of course, theoretically we knew long before this. I actually said I refused to write a book because I was on sabbatical. And Lauren said, let me talk to the professor. And so it was a student again who brought a major transition. And we ended up publishing The American Healthcare Paradox, Why Spending More is Getting Us Less. Between publishing this, which became widely cited, and becoming the head of college at Brantford College, I began to realize that translating research into practice and speaking publicly about it was very meaningful to me. More and more, I felt drawn to the basic questions of creating and sustaining learning communities that are free to question the status quo, open up to new ideas, and empower voices that have important contributions to make, but for any number of reasons have been marginalized. Another transition was still in my future at this point, although I did not know it. I'd begun to teach in and direct the Grand Strategy program at Yale, and Professor Tim Snyder's book, Black Earth, influenced me greatly. In it, he argued that during World War II, the areas, the regions, the districts that were able to save more Jews were those where there was local leadership, where local efforts like mutual aid societies or community centers, local schools, clinics were robust, and people knew each other as part of the community. President Trump was elected in 2016, November, just as Vassar had reached out to me about their presidency. And in the context of increasing authoritarianism in the US and abroad, I was drawn to the importance of leading an institution to be trusted, to be inclusive, responsive, and accountable to its community. And not just its community, but the public at large. Like all my other transitions, I took time to think, to imagine a new focus, to consult my mentors, again, some of you are right here, and to feel what it might be like to lead a college. And not all at once, but over time, I realized I wanted to try. So I left Yale and moved to Vassar. Ironically, the more I changed, the more I stayed the same. And many of the methods I worked on, including positive deviance and capacity building in low-income settings, I now feel that I apply every day to liberal arts education. We have an ongoing study right now of positive deviance in colleges in the US. Do you know that across the country, only 50% of colleges graduate only 50% of the students who start? I mean, when you place it like Yale, you figure people start, they're going to finish. But most colleges, it's not like that. There's a whole set that graduate like 30% of the people who start. Well, we have models now, statistical models, to get a predicted graduation rate. And of course, we're looking at those colleges that have huge actual graduation rates compared to their predicted, because a lot of it's about money. But if some are in very poor settings and still graduating a lot of people, what are they doing? What can we learn from them? So with the help of the Lumina Foundations, we're now visiting these institutions, studying them intensively, and hopefully we'll have time and understanding to find out, how do you do that? How do you take in a poor setting and actually graduate most people who start? Of course, we want to learn enough that we can spread it widely. My interest in global health also can still be lived out at Vassar. We are working very closely with the University of Global Health Equity, the late Paul Farmer's project in Rwanda. And our goal as a Vassar community is to help them teach in a multidisciplinary way the liberal arts to medical students, because no one really goes to college there before medical school. It's high school to medicine. So how can we impute and get that approach to liberal arts education where those medical students can learn to question things, be critical thinkers, think outside the box? And of course, every day on campus, we're working to sustain an inclusive and responsive culture and an institution, this is so important to me, and I think is probably for all of us, an institution that can be trusted by its constituents and by the larger public. So what to make of this bundle of experiences, I'm not wholly sure. But a few patterns do emerge for me. First, students have always been at the center of change for me. They often do not know it, but they have opened many doors in unexpected ways. Listening to those voices, if we are to be scholars and educators, is so fulfilling as the learning goes both ways. Second, the pursuit rather than the attainment of truth seems crucial. It's so easy to get lulled into a false sense of security and superiority by a good p-value, or a New England Journal of Medicine publication, or dare I say tenure. I prefer to keep my eyes open on the questions I still have, the problems that persist that I think I may be able to contribute to addressing, and new contexts that challenge my extant way of thinking. It's a very tough approach because one goes from being an expert in some area to being completely new and unfamiliar. And I have felt that many, many times. At the height of accomplishment, I've moved on to open a new area of inquiry. It is not for everyone, but it has made for a very meaningful journey for me. And last, if change is the through line of this talk and my career, I must end in paradox, as all this change has only been possible because of the tremendous stability that has come from my love-filled marriage with John. The stability of our health, which we all know is so important, and the many institutional and personal supports that Yale and the Academy at large have provided me. And I am again so humbled and so grateful to be with you now. Thank you. I appreciate that. Yes, we have time for questions or
So we have time for questions, and Maroke is in the back with a microphone. So if you guys want to raise your hands. Betsy, I can't thank you enough.
Oh, my pleasure.
Both the humility, but also the drive to make the world a better place shines through, and the grounding and rigor
Thank you. I
is
appreciate
what hopefully we all stand for. I do want to give you just a little thank you gift as we start getting going for questions. So
Ooh, what is it?
It's a little
Chocolate?
bit of Yale swag always, right? We can't do a talk without swag.
Do not let my
You
board
can take
see
your little
this.
note.
Okay. Very cute. Thank you so much.
Enjoy. We'll let students and others take questions. So
Hi, thank you so
Student,
much.
I'm just warning you.
Yes.
You may be about to change my life. So
Uh-oh.
go ahead.
Hi, it's really good to meet you. Thank you so much for
What's
your
your
time.
name?
My name is Rod Bravo. I'm an MD MPH student, MPH part here.
Meet
You too. I have a question about, it's a little bit distal from what you mentioned, but there are a couple times in your narrative when you described how you kind of went with your gut and you went forward with career paths or decisions in the branching of your evolution that maybe went counter to what you were advised to
Yes.
by people who are probably as impressive as you are now. I would just like to hear about where you sort of get that personal leadership, or what guided you internally to be like, I hear you, you probably know more than me, but I know more what's best for me. How you went about that?
It's a great question. How do you just be a complete rebel your whole life? Yes. Well, first of all, it sounds in retrospect like, oh, it all fits into a pattern and it was easy. Let me just say every transition is heart-wrenching because you're always losing something you love. But I do feel like there is an intellectual part to it where you can pro and con, et cetera, all you want. But in the end of the day, you are the only person who knows you. And at the end of the day, even your mentors just don't know exactly. And a good mentor, and I know a certain mentor who taught me this, is one that gives you advice but doesn't care if you take it. So I've had a lot of mentors like that, which I love, because they tell me, oh, you've got to watch it, don't do this, don't do that. But then I remember they gave me freedom to say, yeah, but what's in my heart? What do I think I could contribute to? I won't say it's all emotional, but there is a piece that's emotional. And the other, honestly, is you don't have that much time in the world. What are you uniquely, what can you contribute to? That's a problem out there. And that really drives me, because I think that's kind of what it's about. I was given some skills. There's some problems out there. Where's the match? And that changes over time. So I hope that's helpful. Yeah, yes.
Thanks. Hi, my name's Paul Anastas. I was arriving here on the faculty as you were departing.
Nice to meet
so
you.
It's a real pleasure to meet you. So I think it's so wonderful to hear your reflections. And I absolutely share your perspective on needing to recognize and celebrate the good things about the Academy and what we do right. I think it's probably equally important to ask ourselves, so what is the Academy getting wrong? Mm-hmm. About what we value, about what we incentivize, about what we reward, right? In order to be most effective in addressing these great global challenges that we have. What would be your reflections on that?
Oh, what a great question. Hard. There are a couple ideas that come directly to me. We're losing trust. We're not that trustworthy. We have a ton of assets and we don't share them with the public. We write in ways that are inaccessible. So, of course, we're not trusted. And healthcare went through this. In the 70s, 60s, people still thought their doctor was awesome. By the 80s, 90s, people were saying, what are they trying to rip us off? I feel like I'm reliving that whole unfolding of healthcare in higher education. And what would we have said to our 1970s self to healthcare? We would have said, don't make quite as much money. You can't be quite as greedy. And you really got to make it accessible to people. Think how to make it accessible. So this I find very compelling. What can we do in higher education to answer the problems that people have in our community? And that's hard when we're steeped in a language that the average person who's walking down the street of New Haven is not going to necessarily be excited by. They could understand it if they had time to sit, but they're not that excited by it. So I think that's very important. I also think that we have to take a really hard look at how many resources we really need versus how many resources we have. Because I've been in low-income settings that have been transformational for people, and it was due to leadership, community activism, community sense of self-empowerment. It wasn't due to resources. But in higher ed, we have these top 100 institutions that have all the resources and 28 other 100 other colleges and universities that hardly have any of it. So we have a really inequity problem. So how to solve them? I don't know. I always try to turn to culture and leadership. And I think that really comes from faculty too. It's not just an administrative task. It's really a scholarly task to think, how do I make my scholarship meaningful to someone bigger than my institution or my own department. Yeah. But thank you. So yeah. Thank you for the question. Oh, you were going to ask one, Melinda, and then you just got scared. Why? What did you want to ask? Oh, same thing. Okay. Do you have an answer? Do you want to answer that one? Yeah. Because I could learn. See, watch it. I am like a sponge. I'll take. Oh, there we go.
So good to see you, and
so
thank
good
you.
to see you too. Congratulations on your career and everything.
Oh,
okay.
You mentioned insecurity. At times, you
Yes.
felt insecurity,
Yes.
and we often hear the term imposter syndrome.
Yes.
So
yes.
so at times that you felt insecure, whether it was a transition and whether to go for it or not, what helped you in that time period?
Family. I remember saying to John, maybe I should quit hospital administration, and I just go back to school, but I really don't think I'm smart enough to get a PhD. And he said, what? Of course you're smart. So family, I think, really helps. People who love you, friends and family, is big. Time. You know, honestly, we're all insecure. I mean, it's an insecure world we live in. Don't you all study food insecurity and every other thing? We're an insecure people. So sometimes it's time that you just breathe through it, because you're just gonna be insecure for a minute, and then you'll find your footing. I think that's important. I also think the fall back to habits that have been successful before, that are truly from your heart, that are truly who you are, and you start to put that habit in a little bit. I remember when I first got to Vassar, 6 weeks into the job, it's a very activist community. I'm sure Yale is too now, but let me just say it's very activist at Vassar. And I had this meeting with all the student fellows who are sort of the student leaders, and you know, they wanted to know about the budget, and I'm like, great, I'm very transparent. I put a PowerPoint together, I got the budget, it's totally out of whack. We cannot afford to do what we're doing. I mention the word financial aid, and they go through the roof, just like, she's gonna cut financial aid. Oh my God, it was horrible. So if they could have thrown tomatoes, they would have been throwing tomatoes. It was so bad. There were 200 students in the room. It was so bad. Been there 6 weeks. I walked out, and I'm like totally shaken. Like, why am I here? And I had a few students come up and hug me afterwards, because they were so sorry that the other 198 had met. But anyhow, I got home. I was so insecure. And the next day, I had to get up on that campus and like walk through the campus to get to my office. And there were all these people passing me, and I thought, what's worked before? What's worked before? And I said, smile and say hello. So I go, hey, how you doing? Good to see you this morning. And they're like, but I just kept doing it. Do it. And now, you know, a lot of people smile at me and say hello. So kind of the fallback to the habits you have that brought you comfort before, I think can be really helpful. Thanks for the question. I'm getting PTSD again, remembering that.
We have a couple of questions on the Zoom as well,
sure.
so maybe we take one from here.
Sure.
So, do you think the career and professional future for young women today is different, better than what you faced with, you know, the mommy track story?
You know, it's so hard for me to answer that question, because I'm just not 22 years old anymore. So is it better for a young adult than it was for us? I sort of believe every generation has tremendous challenges. I think the challenges are different now. The challenges in the early 90s in healthcare were women just were not in leadership. That's all there is to it. There's more women in leadership. College presidents, like 30% are women. So still so far to go. And then I think this generation has so many more challenges in terms of, the sexualization of women in the workplace. That's probably always been true, but it's such a complex moment right now. The gender transitions that are going on. So where is feminism in the world? I think the political authoritarianism and how that gets played out on gender as well. I think that life today for young women going into careers, I think, is really equally probably as hard as it was, but the challenges are somewhat different. And when does that all end? We have such a social and cultural practice of having women really in a second spot and constraining what women can be. So that is a lifelong challenge to try to address. Yes?
Thank you for your candid meditations on your career. I think apart from some of the questions that have been asked, three themes that kind of arose out of your talk for me were curiosity, serendipity, and as you said more recently, trust. I think trust.
That's great. I'm going to take that note. Thank you.
I think trust for me implies kind of like a discursive relationship, a dialogic with the community.
Yes.
And the corollary is accountability.
Yes.
So I guess my question for you, particularly within this age of distrust of the academy, distrust of science, is who are your community, and to what extent does accountability to that community define what opportunities you pursue, or the research questions that you ask?
Yep, great question. So maybe we could just step back for a minute before answering that and think about trust and what breeds trust. In a short nut of a idea, I like to think a lot about integrity, and what I mean by that is you keep your promises. And once that's your definition of integrity, and if I tell you we're going to be in a relationship and I am going to keep my promises to you, I'm going to be very careful what I promise because I have to keep it. And that gives you such freedom to be able to say, I know you've asked me for this much. I can't do that much. I can do this, and you can hold me to my promise. That's very, very big, and it makes it more palatable than imagining the world is my constituent, and I have to house every homeless person in Poughkeepsie, and I've got to be sure the schools are working. You just can't do that. But I do think, to get to the actual question you asked me about who are your constituents, for sure you have to think about who is actually financing your operation. They have to be your constituents because that is the sustainability over the long haul. And we can't just think of today's population in these institutions. We have to think they're here for the long haul. They're endowed institutions. I think the community that is affected by your actions is another constituent, and that's huge. That's employees, that's students, that's the community around you. It's the global community, it's the peer higher education institutions. So thinking always what your impact is going to be, regardless of what your intention is, what is the impact? And who's ever being impacted, that's a constituent. And then your family is a huge constituent. So that's sort of how I think about it. But I'm very careful what I promise. And an example of this is our students wanted to be carbon neutral by 2030. And by the way, we are going to be. And I tell you, I just did not know how to do that. I was like, this is going to cost so much money. So we brought them into a committee to say, I'm never going to lie to you. You're going to see all the data, and I'm never going to promise something we can't do. And it was the students who finally said, okay, do it this way. We cut our carbon from what was 30,000 metric tons to now is 10,000 metric tons of carbon being put out, and the rest is going to be offsets. They wanted more than 10, get further, but once they saw all the data, they're like, oh my God, you can't possibly do that. That's like $50 million, which is a lot at Vassar. I know it's nothing here, but it could buy you a building across the street, yeah. But I think being able to have the sort of capacity to say, I will always keep my promise. And it really gives you discipline about what you promise. And then it lets you be trustworthy, even if you're disappointing to people. They can deal with it because it's in a trustworthy way that you had to disappoint them. Yeah.
Hello, my name is Abel, and I'm an undergrad in Berkeley College. So thank you so much for this presentation. And I'm originally from Ethiopia, so...
Figured when you said Abel. Is it Ababel?
Say that again?
Is it Ababel?
Oh, no, just Abel.
Abel.
Or
Okay,
Abel.
shortening. Okay.
So, yeah, I really kind of resonated with you in regards to just, the philomath kind of characteristic of having a lot of different interests and not really settling in. But I guess tying that into just what your experience has been, doing a lot of different things, how have you kind of gone about juggling, trying to tackle health problems within the United States and also taking your talents or your abilities to, I guess, low-income resource areas such as Ethiopia, and kind of really thinking through kind of those opportunity costs or just those considerations that you make in regards to just what you work in.
It's a tough question. You could hear from my story, I've toggled back and forth. However, I've been very careful to do the things I think I can contribute to, because global health is just a ginormous field. And I have not gotten mired in whatever the disease is, whatever the country is, I'll be there. We really focused on what I felt like I had a unique perspective on. And a lot of that unique perspective I was using in the US as well. So there was, as much as there was difference and spread, there was some commonality, something that would cut the choice set down a little bit. The question though of but how do you decide whether it's going to be New Haven or Shashamene? And I think it's a combination of different things. How much of an impact do you think you can make? What's your gut saying? Where do you actually feel like you're flourishing? Because if you're flourishing, probably the people you're working with are. And what's practical at that point in your career? What's really practical? Because so many of us have brilliant ideas, but if you really just can't, it's not practical to do, you got to think up something else. So that's how I've made my decisions. I'm sure there are better ways to do it, but I'd love to talk to you about Ethiopia after this. Can we speak a little Amharic? Tinish, tinish. Okay. Do you speak Amharic? Okay, Okay, I got it. Yeah. Yes. Jacques.
Hi, I'm Jack Carew. I'm a first year PhD student at the school. And I really like hearing about your work in global health and also your work about kind of like academic accountability and trust. And I am curious, kind of how those two come together in a couple specific ways. So I know like sometimes when people work abroad or whatnot, like there's a lot of discussion about doing kind of collaborative work in which you don't just take samples somewhere and bring them back to the and run tests. But kind of above and beyond that, I'm curious about ways that you in the past or things that you've seen have kind of encouraged trust within those communities.
Yeah.
So for example, I think like publishing papers, oftentimes like they're published in English or like whether there's an abstract available in a local language
Yeah.
or in the community or like more accessible kind of newspaper,
Yeah.
or kind of other ways of disseminating information. If you've seen that, if you've pursued that in the past.
Yeah.
And I've done work in Jordan and Morocco before, and I'm going back to Jordan this spring to do a Leishmania project.
Wow.
So I'm very excited for that.
So
I'm curious
excited.
if there's anything you suggest.
Yeah. For me, the most important thing is having relationships really in the community that you're working in and how you're introduced to those relationships, what kind of, I have to say, attitude you bring to it, what kind of structures do you bring to it, what kind of compensatory arrangements are there that truly empower the team. And I haven't been one, and I've seen other universities do this, to be like, we're going to pay you so you can do everything. Because I don't think that's actually what many of the constituents and communities I've worked with want. They definitely want to be compensated for time, but they want us too. They want the collaboration. They're looking for what we have and we're looking for what they have, and together we could solve something. And I find this very much at the University of Global Health Equity in Rwanda. They really don't know how to do inclusive pedagogy and liberal arts, and we do that really well, and they would not want us to say, oh, we'll just give you some papers, and they want us physically to be there building capacity. And we are learning so much about teaching STEM in a way that really is life-giving in a very low-income setting, which they have. And so there is sort of a complementarity to it that I think is really fundamental. I think there are a lot of tactical things you can do too. I've often worked in English-speaking areas, so that was a choice of mine because I didn't want to be, and then I tried to learn the language. Wait till you hear me speak a little more Amharic. And I've tried to learn the language as much as I can, but also writing, publishing, you always want a co-author. You always want people who are living there to lead, if possible. Anyway, you can make, not up for, but you can think hard about the power dynamic and what it's doing and how can you inoculate the power dynamic. You never can totally, and it's good if you can just talk about it, because you never can. But I think there are ways in which you can all benefit from the relationship. And if you really want to talk to someone who really knows how to do this, you need to talk to Marcella Nunes-Smith, because she really knows how to do this. No, it's true. No. Wrong. Okay.
So we have about 5 more minutes. I'm thinking we take one question from Zoom. All right. This is from Jill Zone. Using your view of healthcare from the balcony, do you have any thoughts about why proportional investment in social supports and in public health does not seem to have increased in the US despite the COVID pandemic? How do we make progress on this very important policy approach?
Oh, you had to end with a doozer. All right. One of the hardest things is not figuring out what social services to invest in and seeing the actual impact on health, because you will see it without question if you're investing in Meals on Wheels or nutritional support or housing support, lots of case management programs, you will see it. But the tough thing is how to dismantle the medical care piece of it. So we're always saying, well, where's the healthcare cost savings? In a small area, you can find it. But of course, that's going to squeeze out into some other area because our medical care system is built on a market, a commodified market, and a lot of people are benefiting from the profit that goes along with that medical care system, and our public likes that. I mean, it's horrible to say because we don't really like it, but actually when we're sick, we want the MRI tomorrow. And we can get it because there are like 40 of them in New Haven. That's not quite true, but there are more in New Haven, I think, than most of London. So it's, it is just so hard. We're a population that I think has been brought up on medical care misconstrues all the time that medical care will solve our health problem, and we feel comfortable with it. And I don't know, it's almost 20% of the economy, so how many people are making their income from this medical care system? So I think that's why we haven't seen a transformation in the United States, because there are too many vested interests, and it feels too good for the people who are benefiting from the medical care system. And we're not a collective culture. We are a culture that lives with 10 to 15% of the population completely marginalized, shut out from accessible healthcare, and we live with that. It's not like that all over the world, but it is like that here. Do we have to end on that note? That's just so bad.
Yeah.
This one, yes, because one of my students, so watch out.
Okay, I mean, a positive anecdote. I loved your story about students changing your life, because I'm here because you changed my life. In 2016, when I first decided
I remember.
to teach,
Yes,
we had a phone call,
I
and
remember.
It was the day after the election, and I remember we were both really depressed and sad. And
I was thinking about, am I going to Vassar or not? Yeah, go ahead.
So the relationship, I think, is mutual. I wanted to get your thoughts, though, from just a leadership decision-making perspective. In my class right now, we're debating, and what is the moral responsibility of the hospitals to their communities?
Yes.
And let's say, and your example of the carbon footprint reminded me of this. As a leader, you're called to make short and long-term trade-offs all the time, and within constraints. So the ideal design is never what happens. So I was just curious to get your perspectives on, like, if you were a healthcare CEO, a hospital CEO, a safety net that is losing money, your ORs are broken, your ED is overflowing, and then the main issue in your community is actually housing, and that's why people keep rotating. And you get a new grant. Like, how do you make those trade-offs? And you don't have to have a specific answer of where you put your money, but so curious as to how you, as a leader who has to make these trade-offs, consider that.
Yeah. Well, first of all, Lauren Taylor is doing a study with the Greenwald Foundation on this exact question. So email me afterwards, ebradley@vassar.edu, and I will definitely connect you if you haven't met her or worked with her before. I think as a person in a leadership role in that kind of situation, one thing you have to be very cognizant of is the process by which you make decisions. Because the decision itself is important, but also the decision, what kind of timeline you have for the decision, who's being counted in the pluses and minuses of the decision feels very important. And being sure that the communities that are most affected by your decisions are, in fact, being able to voice in a dissenting way, if needed, what your potential approaches are. And sometimes if you use a process that you can live by and feel is trusted and transparent and ethically grounded, you can live with the decision. The process was okay. In terms of the actual decision, putting me on the hottest spot, I mean, I did take a lot of economics here. I rebelled against economics a lot too. And I almost just turned this off so you wouldn't hear. But I do feel like you have to keep the long term in mind. There's no choice about it. The long term is here before you know it. And that often means not being quite as responsive in the short term because you have to think about the long term. The issue is, of course, you want to be as creative as possible with that. Paul Farmer was great at this. He'd say, like, screw the long term, give them it all right now. He and I were a little different on things like this, but to have enough courage to say, let's really look at the trade-offs between now and later. If you make all the trade-offs for later, you don't live long enough to do later. So there has to be, but if no one in the leadership role is thinking about the endowment, if you say, the children that are coming after these adults, where are we then too? So maybe it's a both and, but I think the most important thing is the process you use to make those decisions. Yeah, okay. Whew. Thank you so much. I really appreciate it.
So, Betsy, thank you. I cannot imagine a more inspiring Dean's lecture. Again, emblematic of all the things we stand for here at Yale and at the Yale School of Public Health. I do want to invite those in the audience on your way out. We do have lunch outside. Please enjoy and join me again in giving a very warm thank you and round of applause. So.